as we completed the anterior uveitis, so anterior uveitis நம்ம in detail நம்ம பார்த்திருக்கோம், starting from the anatomy, how the anterior uveitis can occur, what are the structures possible, what are the etiological causes, granulomatous, non-granulomatous or difference என்ன, how do you manage those patients, and what are the complications. So all these things we have already seen, and today we are going to discuss about the intermediate uveitis. So as I already told you, intermediate uveitis, the structures which are involved are either the pars plana, or it's going to be peripheral retina, or it's going to be a vitreous. So vitreous involvement vitritis அப்படின்னு சொல்லுவோம். உங்களோட posterior cyclitis அதாவது உங்களோட pars plana involvement pars planitis சொல்லுவோம். ஸோ இதுதான் உங்களோட இது. அண்ட் posterior cyclitis, not the posterior uveitis, just the posterior cyclitis. ஸோ இது மூணும் சேர்ந்து தான். ஓகே, now what are the causes? Causes is very simple. Idiopathic is the most common cause. Okay, so most common cause is idiopathic. Pars planitis, it's a subset of your intermediate uveitis where there is a snowbank or snowball formation. What is the snowbank or snowfall formation? I'll tell you. Okay, எதனால இது வருது அப்படிங்கிறது you have to understand. I'll tell you. Now, first thing is going to be there is going to be a vitreous cell. ஸோ இதில் எல்லாமே எங்கே இன்ஃபெக்ஷன் வருது அப்படின்னு பார்த்தோம்னா மோஸ்ட் காமன் சைட் ஆஃப் இன்ஃபெக்ஷன் இஸ் கோயிங் டு பி a vitreous. ஸோ விட்ரஸ் செல் இருக்குது. இந்த விட்ரஸ் செல் தான் வந்து பார்த்தீங்கன்னா இட்ஸ் கோயிங் மோஸ்ட் காமன் சைட் ஆஃப் இன்ஃபெக்ஷன். ஸோ தேர் இஸ் கோயிங் டு பி அக்யூமுலேஷன் ஆஃப் செல்ஸ். ஸோ வாட் ஹேப்பன்ஸ், தீஸ் செல்ஸ் ஆர் கோயிங் டு clump together to form this so-called snowball. So this so-called snowball. Okay, so what happens is the cells are going to clump together to form a snowball, which will be most commonly present in the, it is most commonly present inferior quadrant. ஓகேவா? ஸோ இந்த ஸ்னோபாலில் என்ன ஆகும் அப்படின்னு பார்த்தீங்கன்னா தே ஸ்லோலி வாட் ஹேப்பன்ஸ் இஸ் தே சிங்க் டவுன். ஸோ ஸ்லோலி தே ஆர் கோயிங் டு சிங்க் டவுன் டு ஃபார்ம் அ ஸ்னோ பேங்கிங். இட்ஸ் கோயிங் டு ஃபார்ம் ஸ்னோ பேங்கிங். ஓகேவா? ஸோ ஃபைப்ரோவாஸ்குலார் ஆர் எக்ஸுடேட்டிவ் பிளாக் அப்படின்னு நம்ம சொல்லுவோம். ஸோ வாட் இஸ் திஸ்? ஸ்னோ பேங்கிங் இஸ் நத்திங் பட் தே ஆர் கோயிங் டு பி த ஃபைப்ரோவாஸ்குலார் ஆர் எக்ஸுடேட்டிவ் பிளாக். ஸோ வாட் இஸ் திஸ்? தே ஆர் நத்திங் பட் fibrovascular, or they are going to be exudative clump. Okay, so exudative clump, or you can call it as a plaque. So this is going to be present in the inferior quadrant, and this is the pathognomic sign of pars planitis. Or pars planitis, it is going to be the characteristic feature or pathognomic feature. So apart from it, you are going to have a macular edema. So it's going to be the most common complication is cystoid macular edema. So this is the visual loss cause the main important problem. So most common cause of visual loss and spillover of anterior uveitis. So what happens is, so there is going to be a spillover. Okay, so in the middle part la irukkoodiya and the cells on the spill agi, it can cause anterior uveitis and vitritis. So it can cause anterior uveitis and vitritis. So anterior segment involvement to varalam. Okay, so what are the causes? So causes appdi nama paathona, it is often associated with a systemic disease such as sarcoidosis. So it's often associated with systemic disease such as sarcoidosis, Lyme's disease, or there can be a peripheral toxocariasis, or there can be a primary intraocular lymphomas, there can be multiple sclerosis, syphilis. All these things can cause a pars planitis. And coming towards the Lyme disease, I wanted to talk specifically about this Lyme disease because so Lyme disease is due to a tick exposure. Okay, so it is again consists of 3 stages. Stage 1, stage 2, and you're going to have stage 3. Stage 1, stage 2, and you're going to have a stage 3. What is the stage 1, stage 2, and stage 3? Stage 1 is nothing but there is a erythema chronicum migrans with a follicular conjunctivitis. Erythema chronicum migrans plus there is going to be a follicular conjunctivitis. Stage 2 is a intermediate uveitis with arthritis. And stage 3 is going to be a bilateral keratitis with episodic arthritis. with episodic arthritis. Clear? Okay, so you know this. Now, what are the signs I told you? There is going to be a spillover of your anterior uveitis and vitritis, which is going to be the hallmark. So, there will be a snowballs, snow banking, and retinal periphlebitis with venous sheathing, you can see. So what are the symptoms? It's going to be mostly asymptomatic. If at all symptom is there, they are going to be insidious in onset with bilateral blurred vision, and there can be a floaters. ஒருவேளை defective vision இருந்ததுன்னா cystoid macular edema வரலாம். ஓகேவா? So there can be a indirect ophthalmoscopy is going to reveal you a snowball opacities at the peripheral retina which coalesce to form a white plaque. That is called as your snow banking. So can you see here? Okay. Now coming to the complication, as I already told you, cystoid macular edema and epiretinal membrane formation, neovascularization, vitreous opacities. Now coming to the treatment. So treatment you call it as Kaplan 4-step protocol. So what is the treatment for this? Your treatment for this is Kaplan's 4-step protocol. So what is this Kaplan's 4-step protocol? I'll tell you. 4 step now. First, you're going to give us a periocular steroids. So that is going to be the drug of choice. Periocular steroid, that is going to be drug of choice, where you're going to give posterior subtendon space. You're going to give in the posterior subtendon space. This posterior subtendon space la kudukra and the method you call it as Nozick technique. Okay, Nozick technique. So where do you give posterior subtendon space? Clear? Yes. So, and it is going to be of it's going to be triaminoxylon acetonide. So, you are going to give triaminoxylon. So, triamcinolone. Sorry, I'm very sorry. Triamcinolone 40 mg is most commonly used drug. So, what is that? You are going to give triamcinolone 40 mg is going to be given most commonly. And what are going to be the complication of this? Ptosis, periorbital hemorrhage, and globe perforation. Ptosis, periorbital hemorrhage, and globe perforation. Okay. If the periocular steroids are not effective, then you go for the systemic prednisolone. So the second line of drug is going to be the systemic steroids or intravitreal steroids. அதுவும் fail ஆகுது. மூணாவது immunomodulatory therapies, or you can also give cryotherapies, photocoagulation, அதெல்லாம் நம்ம பண்ணி பார்க்குறோம். அதுவும் எஃபெக்டிவாக இல்லைனா finally you go for a pars plana vitrectomy. So this is called as Kaplan's 4-step step ladder approach for the treatment of your intermediate uveitis. Clear? So this comes to the end of intermediate uveitis. A very very short topic. Or 5 minutes கூட ஆகாது இந்த intermediate uveitis முடிக்க. ஒரு short note. Okay. So அந்த short note ஈஸியாக நம்ம கவர் பண்ணிட்டோம்.